Pfizer is now recommending boosters and possibly a third vaccination shot to keep people from contracting the Delta variant of COVID-19. As we know, the Delta variant is highly contagious. Meantime, researchers are working diligently to know more about this strain of COVID-19. And with that said, I am bringing in Dr. Daniel Rhoads into the conversation. He is a microbiologist with Cleveland Clinic. And as we look at this Delta variant, Dr. Rhoads, what can you first tell people who are vaccinated, who are still worried, though, about getting this particular strain?
Yeah, good evening, Betsy. Yeah, if you're vaccinated, if you're fully vaccinated, the evidence shows so far that you're still very well protected against COVID as a disease. There's a small chance, there's a chance that you could become infected, but most people who still become infected even after being vaccinated don't get severe disease. And that's really the goal, is to keep people out of the hospital, keep people able to recover quickly.
On the other end of that spectrum are those who are vaccine hesitant, who refuse to get the vaccine, no matter what company it comes from, for whatever reason. You say to them what, especially when we're talking about the Delta strain?
Yeah, I try to point out that everything has risk, and a lot of the arguments for not getting vaccinated, people point to the risk of the vaccine, but I think it's important to recognize that not getting a vaccine doesn't obviate the risk. There's a lot of risk in not getting the vaccine. So people choose their risk, and I would say it's much less risky, and the evidence shows that it's much less risky to get vaccinated than to not get vaccinated.
Yeah, we've learned a lot about COVID-19 over the last 18 months or so, and there's still plenty that we're learning, especially when it comes to these variants. This one is highly contagious. A lot of people are thinking, you know, we're coming out of the pandemic, we don't need to worry about it anymore, but that is not the case necessarily.
Yeah. Coronaviruses, the common coronaviruses that have been with us for centuries or millennia, typically in the northern hemisphere where we're at in the summer months, June, July, August, coronavirus almost goes away. It's not really found in the population. Come winter time, flu comes, RSV comes, coronaviruses come. I would not at all be surprised if COVID behaves similarly to the other coronaviruses and is really a winter virus. So I would say if the prevalence of COVID is low right now, enjoy it, get your vaccine, and get ready for winter.
Have you studied the different vaccines that are out there right now? Because people who are saying, okay, I haven't been vaccinated yet, but I think I will, they keep weighing the options of the Pfizer, the Moderna, or the Johnson & Johnson one. And so from what we keep hearing in the media is that they're all very effective, but people still think that they want to pick and choose.
Yeah, something is better than nothing. If you have the option, the RNA vaccines seem like they maybe work a little better, but all of them work very well.
This Delta strain is highly contagious, and so with that said, we've all thought with COVID, the hand sanitizers, the hygiene, personal hygiene, and so many ways that we tried to stay away from COVID-19 in and of itself when the pandemic first started. People aren't doing them as much, doing the various things to try to stay away from COVID-19 anymore. But with this Delta strain, I guess I want to really hone in on just how contagious this is, how serious people should still take this.
Yeah, it's very contagious. It's likely that the Delta variant will replace the Alpha variant. The Alpha variant, we used to call it the B117 variant. So it's definitely more contagious. It's definitely affecting younger people more than the original variant has up until now. So now's a perfect time to get the vaccine before the next wave comes.
Okay, so kids are going to be going back to school at the end of August, beginning of September, a large majority of them. That's when they start. Kids are not getting vaccinated at a certain age and under, so then we have to worry about not only the Delta variant, but kids going back to school, the contagious aspect of this. What do you say to parents or teachers who are going to be heading back into the classroom?
Yeah, it's challenging. And like I mentioned earlier, there's risk in everything. So thankfully, a lot of viruses like COVID-19, children typically don't get as sick as adults when they get it. However, they can spread it to adults very easily. So it's really important that those that can get vaccinated, especially older individuals who are higher risk, take that opportunity, because I anticipate that children will have the opportunity to spread COVID, even if it doesn't make them very sick.
Yeah, they are little germ magnets, aren't they?
Sure.
Do you think that we'll start seeing recommendations for kids who are younger, who currently are not eligible to get vaccinated? Will we be seeing that in the next few months? Do we know that?
Yeah, we don't know for sure, but we know that the companies are doing studies in younger individuals, and everything that I've heard so far is, I've heard nothing but good things. I expect that vaccines will be available to children in the future. The timeline is unclear, though.
Yeah, it's a wait and see. That's how we've been kind of living our lives these days. Dr. Daniel Rhoads with Cleveland Clinic, I really appreciate your time, sir. Thank you.
Thanks so much, Betsy.
All right, we'll be back.